Life can put us in situations where everything seems bleak and hopeless. But thankfully, there are people who strive hard to help others face this challenge and come out of this darkness. The Cancer Rehabilitation Center at Prince Aly Khan Hospital is one such place where Dr. Sultan Pradhan, Dr. Tapan Saikia, and their team have made it their mission to help people fight cancer and rehabilitate them so that they can lead a normal and healthy life post-cancer.
Surgery for cancer often entails very drastic procedures, very mutilating procedures, and the treatment can never be complete once the surgery is over, because rehabilitation forms an integral part of the treatment of any cancer patient. I had wanted to have a support group for cancer rehabilitation for many years, but you need to get the right kind of person to do that. Until Anita came along, she's a wonderful motivator, and today the large rehabilitation group that we have is entirely because of her efforts.
I'm Anita Vesuvala, and first of all, let me tell you that I am a breast cancer survivor. After my surgery, the doctor told me that I could go home. And the first thought that came to me was, how do I go home, a mastectomy patient with a vital part of me missing? And what made a big difference to me was I met another cancer patient, and when I spoke to her and when she told me about her problems and when I saw how well she had recovered, it was at that time that I felt, well, if she can do it, why not me? That is how the Cancer Rehab Clinic started 20 years ago with Dr. Pradhan, not only my surgeon, but an excellent doctor and a wonderful human being. He was the one to initiate this idea.
When my treatment was going on, I was feeling very low and it was a very hard time. But the Cancer Rehab Center volunteers have helped me a lot.
When the patients, when they come in for the first time, I feel that they have too many questions. Half of their fear is that what will happen now. So we try to tell them what has happened, but now we have to go forward with it. So how to deal with that? We as a volunteer over here, we help you in that.
Besides counseling, which they really need at that point of time, most people also have another issue, is that in their private lives also, whether they'll be able to function privately with their husbands, etc. So that counseling also we do take on. And also we have the woman who comes here because of the fact that she has lost her breast. She feels very uncomfortable with the fact that there is something missing in her body. So we have these prostheses over here of different sizes, and we actually fit it on personally. Once they're comfortable with it, we actually give it to them and they move on.
मुझे इतना हौसला आया मेरे खुद में कि मैं जो सोचती थी वो इतना डिफ़िकल्ट टास्क नहीं है ये, इससे भी मैं पार कर सकती हूँ।
As time went on, Dr. Pradhan wanted us to start something with laryngectomy. That is when we met Mr. Lahiri at one of the conferences, who is a laryngectomy survivor, and we asked him to join our clinic.
They picked me up because they wanted that laryngectomy patients, they should start esophageal speech training. I was picked up in the year 1998.
ज़बान को पूरा पीछे लो. See, when the cancer survivor comes to us, first we explain to him what is wrong with him. After that, we tell him that we'll teach you how to speak, because they don't have any speech as with the larynx are removed.
Slow, go slow.
When a patient comes to us,
We do train them with all the physical exercises and psychological support. They absolutely come back to normal life.
Very good. I still remember that days when Naima madam told me, say, and very first sound I told, and Naima madam has clapped me, which encouraged me to speak more and more.
3 महीना कुछ आवाज़ नहीं आई थी तो मैं आके छूट के चला गया था। 2 महीना घर पे रहा, अपना नेटिव प्लेस घूम के आया, तो बोला मैं ट्राई करता हूँ। तो वापस 1 महीना आया तो मेरी आवाज़ थोड़ी थोड़ी निकल के इतनी साफ निकली कि आज मैं 12 साल से मैं औरों को सिखा रहा हूँ।
Very good.
That's what we want. Cancer is not the end of life. There are ways and means of surviving and going through it and try to lead a normal life, which I am doing at this moment.
After a few years, we also started off with ostomy patients, where we have colostomy and urostomy. Those patients also come to us and we look after their needs, because Dr. Pradhan felt that these are patients also who have to carry their bags. They need some help from somebody who could explain to them. So we started with the ostomy as well.
First we try to, calm them down a bit and say that don't worry, everything will be fine. You will lead a normal life. Then we show them the bags that we have. After that, how they can take care of themselves, like diet, what food they can eat, what are the do's, what are the don'ts for that. This is the urostomy bag. So these are the disposable bags which last about 4 to 5 days. And it's very easy to apply it and you can easily dispose it. And one more bag we have, this is for colostomy. So this is for collection of stools. So those patients who undergo operation for any part of the rectum or any part of the intestine has been removed. So they have an opening from where this bag is attached and then the stools collect in this.
The main thing about our clinic is it is not only for patients of Prince Aly Khan, but anyone from anywhere can visit us. And our services are completely free.
A good number of the CRC members are cancer survivors themselves. They have gone through it, they've been there, and they have understood very well what sort of questions the patients have. And they train themselves. They're volunteers, but they train themselves so well that they're as good as professionals.
The main thing that I tell my volunteers, that when they come to us, try and make them feel that we are there for them, and by the time they go out after we've counseled them, we can see the difference in their attitude. At least they go back with a smile. They go back with having so many of the questions which they had in their mind answered. So that makes a big difference.
वो खुद बोलते हैं कि हम लोग को भी हुआ था, हम लोग भी ऐसे सिचुएशन में से पसार हुए हैं, पर हम लोग को अच्छा हो गया। तो वो सुन के हम लोग को बहुत होता है कि नहीं, ये लोग को अच्छा हो गया है तो अपन को क्यों नहीं अच्छा होगा, होना चाहिए अच्छा, ऐसा एकदम हो जाता है.
Incidence of cancer in India is growing at an alarming rate, and we have to understand that a very large number of the cancers are preventable cancers. Tobacco, as we know, is a proven cause for cancer, and look at the face. Smoking is on the rise, pan chewing and tobacco chewing is on the rise. And I think that what we need to really do is to focus our attention onto our younger generation, onto the schools, to see that our youth does not take to these habits. Second important thing to remember is that if detected and treated early, the treatments are simpler, cheaper, and without major morbidities.
Cancer is not the cancellation of life, and I am proud I had cancer.
एक दिन मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन.
Prince Aly Khan Cancer Rehab Clinic is run by dedicated, trained volunteers, including former patients and health professionals. Till date, Cancer Rehab Clinic has served thousands of cancer patients. All their counseling services are provided free of charge and available for cancer patients from any part of the world. For more information about Cancer Rehab Clinic, you can contact the Prince Aly Khan Hospital at 23777-800 or 23777-864.